So what do you think might be most helpful right now?
I don't know.
Oh, I think you do know.
What's up, everybody? I hope you're doing well. Today we're going to tackle what's really going on when clients respond with, I don't know, and offer some tools for how to respond in ways that are actually helpful. I've been enjoying dabbling in some clinical topics, and clients saying I don't know in session is something that I think universally every therapist witnesses, goes through at some point. And sometimes when it happens, I mean, even now to me today, it still can sort of stop me in my tracks and make me go, what do I do now? So let me be clear, I'm not like the expert, the knower of all things, but I've certainly had my fair share of moments where my clients say, I don't know, and I don't always know what to do. I don't know. They say I don't know, and then I don't know what to do. But there's also been some tools I've picked up along the way that help in these moments. So I thought I would go over some of the common reasons why clients might say I don't know in session and how to respond in a helpful way. So just for funsies in today's episode, because apparently I just like to challenge myself, I guess, I will have some skits demonstrating what not to do in these situations and then offer some tools for how to respond in a more helpful way. And sometimes it might be a little silly and make you laugh, and why not? Let's have fun while we're here. We're going to dive into 6 different types of I don't know scenarios. I will demonstrate what not to do in those scenarios and offer some tools that I think might work a little bit better. But if you only take one thing away from this episode, it's an encouragement to respond with curiosity and a little bit of humility when your client says, I don't know. We don't want to come from a place of just accepting like they've shut down everything and there's nothing left to explore when they say, I don't know. And we also don't want to come from a space of being all-knowing. We know exactly what they need in this scenario, and so we assert that sense of knowledge or power over them. We just want to stay curious, stay humble, let's explore and get to know what's going on a little bit better. Which isn't that what we're doing most of the time in therapy anyway. It's important to understand that when a client says, I don't know, that's one of those statements that could mean so many different things depending on the situation. So it's really important that we tune into what kind of I don't know is this for my client. If we're able to catch it, then we can respond accordingly. Or if we're unsure, we can kind of invite more information to figure out what's really going on for our client and what they're needing. So let's dive into a few of the most common sort of underlying dynamics happening when clients say, I don't know. The first is the people pleaser.
I mean, I don't know. What do you think I should do?
I'm so glad you asked. Okay, here it is. Step 1, quit your job. Step 2, move to Bali. Okay, hear me out. Step 3, start a goat sanctuary. Okay, obviously I'm just being a little silly with this skit. You would not hopefully recommend to your client that they just up and start a goat sanctuary in Bali unless, that was something they were already planning on doing. But our clients can do this where they say, I don't know. What do you think I should do? And the pull is for us to sort of go, right, I'm supposed to know what my client needs in this moment, so let me just offer a recommendation. And often what's really going on for the client in this situation is some variation of them not trusting themselves, not feeling confident in themselves, or maybe they just genuinely don't know and it feels more comfortable to just defer to you. So when this happens, most of the time, it can be much more helpful to circle back to our client and just get to know a little bit better where they're really at with whatever we're talking about. I remember especially early on for me, whenever a client took a question I asked them and put it back on me and asked me what I think they should do, I always felt so tied up because I knew that I wasn't supposed to just decide for them what they're supposed to do. But then I also didn't really know where to go. And there were definitely some awkward moments where I just sort of volleyed the thing right back to them. Like they might have said, like, what do you think I should do? And then I come back and I'm like, well, what do you think you should do? And that didn't go over so great. I mean, clients can be gracious about it, but that wasn't the winning response in those situations. If it feels appropriate, I might even take a more lighthearted approach to this. Like I might come back to the client when they ask me what I think they should do by saying something like, hey, usually that's something I'm supposed to ask you about. What do you think might be going on? Is it that you really don't know or you aren't sure where to go? And that could be a helpful direction to take. Another reason why clients might respond, I don't know, is to avoid talking about their emotions.
I don't know. I guess I just don't really feel anything.
Oh, perfect. It sounds like you're all cured now. So shall we end a few minutes early? If our client responds saying that they don't really know what they're feeling or what they felt when we're asking about a scenario that they've experienced, that is a great place to be. It's a great opportunity to say, okay, awesome. It sounds like you're not totally familiar just yet with what was going on, how that affected you, or how this moment is affecting you right now. Maybe we can take a closer look at this, see if we can better understand what you're really experiencing so that we can know better what you're needing in this moment. Depending on what I know about my client already, I might follow up by first asking if this is a scenario where they do know what they're feeling, but they're maybe having some trouble talking about it, or they feel uncomfortable. Or do they really just sort of feel like, I don't know what I'm feeling right now, genuinely? And if it does seem like they're genuinely checking in with themselves and they don't know what they're feeling, which is so common and totally why we're here in therapy, then you can find some more creative questions to see if you can find the clues to help point to what they might be feeling. You might say, are you noticing yourself feel it anywhere in your body? And even then, it's not uncommon for clients to still say, I don't know if I'm feeling it in my body or where, in which case I might try listing out some ways that clients can start to experience things in their body, or, if this is kind of your style, if I'm feeling something in my body as we're talking, I might name that, like, ooh, as you were just bringing that up, I felt this tightness in my chest. I wonder if I'm picking up on something here. You could also explore things like using an emotions chart or other tools to help clients identify what they're really feeling. Another common profile for clients saying, I don't know, is the overthinker.
I don't know. I've analyzed this to death and nothing feels right. Ugh, classic overthinker.
Can we not? All right, that skit was a bit tongue-in-cheek. I don't think I know any therapist that would actually respond like that in this scenario. But when our clients feel so stuck in between decisions or what they really need or that sort of thing, we might start to feel stuck with them. Like, okay, well, I don't know what to do either. Or sometimes I've sort of felt like, my goodness, can this client just make a decision already? Like they've been thinking about this for so long. So we might start to get kind of frustrated or annoyed with our client. And there's other ways that we can respond that might be more helpful. Now, depending on your theoretical orientation or your kind of favorite clinical lens you like to observe your clients through, there's definitely different options for how you can approach this scenario. So I'll just share some of my personal favorites. Sometimes I'll lean more into an approach of acceptance and commitment therapy, where I'm going to try to invite the client to name their values and see if there are certain values that they're hoping to prioritize in this decision that they're trying to make. And other times I might lean more into internal family systems and help my client break down sort of these different internal voices that might be pulling them in seemingly two different directions, and try to really separate out the different parts of them, giving them feedback about a decision. So from an ACT point of view, I might respond to my client by saying something like, it sounds like there's a few competing priorities at play here, making it difficult for you to decide where to go or what to do with this. I wonder if it might be helpful for us to pause on the decision for a second and just get to know what values are at play here. And then once we have it all spelled out, we can ask, which of these values do you want to prioritize more in this particular situation, and go from there. And from an IFS point of view, especially if I've already prefaced kind of parts language with a client in the past, I might just jump right into it and say, it sounds like there are maybe a couple of different parts of you at play here, offering very different sounding feedback and pulling you in different directions. So how about we pause on the decision for a moment, because you might just be kind of running in circles if we try to force it, and see if we can get to know what parts of you are offering their opinion in this decision, and take some time to get to know what each of them wants, what each of them is advocating for, and then we can try mediating between them to see if we can come to a decision that sort of feels like it integrates all of these different parts of you. The next context where a client might say, I don't know, is from the guarded client.
I don't know. Well, it's just, we've been meeting for kind of a while now. It would be great if you could bring something to the table. Cool.
This one, I'll be honest, is my least favorite to interact with because sometimes it's really hard not to take it personally. I know logically in my head that it's not personal. My client is guarded because of reasons happening inside of them, but my very human side goes, hey, I'm trying to help you here. Can we do the thing that you're here for? But this is what they're here for. They are sitting in your office or they're sitting on the other side of your virtual therapy session, here present in therapy for some reason. So even though they're showing up from a very guarded space and not really giving you much to go off of, they are here and they don't have to be here unless they're mandated or something like that. So I try to tap into that both for my own countertransference's sake. So I could say, I know this person is here. They clearly, some part of them wants to be here, but there's also some part of them that really doesn't want to go wherever we're trying to go right now. When this happens, rather than trying to like double down and strong arm my client into, participating in therapy, I try to switch the other way and just fully validate whatever might be going on that's putting them in this sort of guarded defensive posture. So I might say something like, wow, I'm noticing it seems like there's some part of you that doesn't super want to be here right now. And yet I know you do want to be here because you are here and you don't have to be. So maybe we can pause on whatever it was we were just talking about and try to see if we can get to know this side of you that's saying like, I don't really want to go there right now. Like we really need to make sure that side of you feels comfortable before we try tackling anything else that we might be here for. You can hear some of my like IFS influences in my kind of go-to response there, but you could use whatever tools your preferred theoretical orientation utilizes for kind of more defensiveness or resistance and that sort of thing. Like you could ask about where they're feeling it in their body or what their thoughts are, what their core beliefs are about if we were to dive in. You can just kind of speak directly to the guarded part of them and validate that side of them. Another common reason why clients say, I don't know in session is because, get this, they just genuinely are unsure. They're being fully authentic and saying, I don't know. Actually, I haven't thought about that.
I don't know. I guess I've never really thought about that before. Wait, you've never thought about it? This is your life, Susan. It's actually Jenny.
I think most therapists get pretty excited when we hit an area where a client goes, oh, I guess I haven't really thought about that before, because we're sort of like pioneering into uncharted territory, and isn't this why our clients are here? And onward we go. Now, depending on what you think the underlying reasons are for why a client hasn't really thought about something before, there are a lot of different routes you could take. But for me, most of the time, the client will say this because they're just genuinely thinking like, oh, I guess I haven't thought about that. And now we're here. Now I'm thinking about it. Let's go. In which case, I just sort of invite clients to explore together. I start to use more assessment type questions. So I might say something like, hey, that's why we're here. Let's kind of see if we can get to know this a little bit more. Is there a particular side of this experience or this story that feels like it's more accessible for us to just kind of explore and get to know a little bit better? Or is it more helpful for me to ask some prompting questions? And depending on what the scenario is, you can just ask more assessment type questions to say like, tell me who was there, or what was going on, or what are your concerns? What are the thoughts and feelings? And you can just sort of do your detective work to get to know what puzzle pieces are accessible for your clients, and then hand them back to your client. Say, okay, now we've sort of laid out some information about this item you haven't really thought about before out on the table. Now that we're looking at it out in the open, do you have any reactions to what you're seeing? Are there any things that you're afraid of or you're concerned about? What would you like to do with this information? And sort of go from there. And though there are certainly plenty more contexts where a client might say, I don't know, in therapy, the next one that we're going to cover for today's purposes is the deflecting client.
I don't know. Anyway, how's your day been? I'm so glad you asked. Finally. You know, I was running a few minutes late actually because I was rushing to get my kids out the door this morning. You know, the little one is just like, I don't want to get dressed. And then the older one is like, Mommy, where's my snacks? And then my dog threw up on our way out the door. The nerve.
My thoughts on this have become a little bit more nuanced over time. Whenever a client sort of volleys something back to me and asks about me in some form, once upon a time in my early days, I used to just like, nope, we got to make this about our client. It's not about me, so don't answer that question. And depending on the client and the situation, sometimes I just briefly and appropriately humor the question. Like if the client's saying, how's your day going? I might say, oh, it's really lovely. I'm enjoying that the sun's out today. Let's get back to what we were talking about with you though, because that's usually how this thing goes. So I kind of just sort of respond very briefly and bring it back to the client in a little bit humorous way sometimes, if that seems like it could be a good fit for the client. Now, if the client keeps doubling down and constantly deflecting back at you, asking about you, well, then you can simply inquire about what that's about. Remember, at the beginning of this episode, I said the priority is to stay curious. So the temptation might be to either cave in and just say, oh, sure, I'll talk about me all you want, or get defensive and say, okay, this isn't about me, this is about you, and sort of doubling down. But if we can stay curious and say, you know, I noticed this isn't the first time that you kind of asked a question back at me, and though, you know, it's flattering, I love that you're interested in what's going on for me, you know, we're here to talk about you, and so I wonder what might be going on there. It may be the most benign of explanations, like sometimes, for example, on the occasion that I work with somebody who moved to California from the South, it is quite common for them to ask me about my life because I think there's just a cultural politeness to that. And how great is that? Can we be more like that as humans? That would be nice. I appreciate that. Like I do those things when I see my doctor, my dentist, or whatever healthcare professional I might be meeting with. And even a therapist, I might say, oh, I want to ask you how you're doing, but I know that's not what we're doing here. So fine. But like, just know that I'm, you know, I think about you and I hope you're doing well. Like that's a characteristic that I at least value as a person. So I want to support my clients if that's also a value of theirs. So sometimes just curiously asking like, oh, I noticed that you kind of brought that question back to asking about me a few different times. What might be going on there? They might have just a super simple answer like, oh, you know, I grew up in the South and that's just kind of how we always did things. That's how we do things there. In which case, most likely, I would just validate this really lovely part of them and very kindly bring it back to whatever it is that we're doing. You know, I might say something like, that's such a wonderful part of you. And, you know, honestly, we could probably do with a bit more of that around here. And though I appreciate you asking me about what's going on with me, I'd love to make sure we use this time for you because that's why we're here. So can we bring it back to what we were just talking about? Most clients don't fight back. Sometimes you just need just a little scotch of that human banter and just say, okay, now back to our agenda. Let's come back to you and see if we can help you. And they can just roll with it. But other times, let's be honest, there's more to the story. The client is genuinely deflecting because they don't want to go there for some reason. And so you've now become the target of their deflection. So if you do that curious follow-up and they still are deflecting, then you can simply notice it out loud and say, hey, it seems like there might be something going on here because as much as I love that you're asking about me, we're obviously here for you. And I could talk all day long about me, but that's not going to help you. So I think we might need to really get to know what's going on here with this part of you that's kind of turning these questions back on me. Is that something you'd be willing to do? And if they answer no, then at least you know what you're dealing with and you can point it back to this conversation that you just had. The next time they deflect, you might be able to say like, oh, there it is again. is this kind of that arena of topic that you're maybe not feeling ready just yet to dive into? Should we leave that one for a different time? Or they might be hesitant to talk about a topic for whatever reasons, and that's why they're deflecting, in which case you can, again, curiously ask about what some of those reasons are that they're feeling uncomfortable, ashamed, embarrassed, just not ready to talk about whatever it is. Now, of course, as I mentioned, there are so many more reasons why a client might respond with, I don't know. But as a general rule of thumb, most of the time it's pretty helpful to have an approach of staying curious and normalizing, validating what they're going through. And if needed, you can pause and sort of help their system regulate as well if they are needing that. And potentially, most importantly, when a client says, I don't know, we don't have to fix it. We don't have to know the answers. And a lot of times, if not most of the time, that space of I don't know is sort of the vast vacuum of like where the therapy work happens. So anytime you hear a client saying, I don't know, it's sort of like, all right, let's put the gloves on, buckle up, pull up your bootstraps because we're going in and it might be a little bit messy, but we're going to do it together and it's going to be okay. As long as your client knows that you are journeying with them, you're not going anywhere and you are going to be okay, then I think you're going to get somewhere meaningful most of the time. Well, I hope you found this episode informative, maybe a little bit entertaining from my cheesy little skits that I had fun making. And I'm curious to know if you have any go-to responses when a client says, I don't know, that we didn't touch on in this episode. Feel free to leave them in the comments below so that other people can glean from your knowledge as well. And before we close, I'd like to thank TherapyNotes.com for sponsoring this video. TherapyNotes helps with all of your practice management needs, from scheduling to notes to billing. They have a HIPAA-secure telehealth platform included for free for all users, and so much more. If you'd like to check out Therapy Notes, you can get 2 months to try it for free with no commitment just by clicking the link in the description of this video. Well, thanks for joining me for another episode where we dabble a little bit in the land of clinical stuff. I hope it was helpful to you. And until next time, from one therapist to another, I wish you well. Here comes the airplane. Everything is awesome. Everything is cool when you're part of a team. Everything is awesome. The helicopter, the emotional avoider.